Did you know that 80% of cardiac arrests occur at home and not in a hospital? This makes knowledge of first aid crucial for every individual. First aid isn't just a skill, it's a potential lifesaver. It's the immediate care given to someone suffering from an injury or illness, and it can make a significant difference. With the right knowledge and quick action, you could be the difference between life and death. In the next few minutes, you'll learn about the 10 essential first aid skills that everyone should know. CPR is a life-saving technique that helps maintain blood flow to the brain and heart in an emergency situation. Picture this: someone has collapsed in front of you, and they're not breathing. What do? Your answer should be CPR, short for Cardiopulmonary Resuscitation. This essential first aid skill is all about chest compressions and rescue breaths. Let's break it down. Chest compressions are done by placing the heel of your hand in the middle of the person's chest and pressing down hard and fast, about 2 inches deep at a speed of around 100 to 120 compressions per minute. This helps the blood continue to circulate, delivering oxygen to the vital organs. Next, come the rescue breaths. After every 30 compressions, give 2 rescue breaths. Tilt the person's head back slightly, pinch their nose, and breathe into their mouth. This helps provide oxygen, which is vital for survival. Remember, performing CPR can significantly increase the victim's chances of survival. Choking is a common but dangerous situation that requires immediate action. Now let's talk about how to handle such a situation effectively. The Heimlich maneuver, also known as abdominal thrusts, is a first aid procedure used to treat upper airway obstructions, or in simpler terms, choking. Here's how it works. Stand behind the person who's choking. Wrap your arms around their waist and make a fist with one hand. Place the thumb side of your fist just above the person's navel, but below the breastbone. Grasp your fist with your other hand and give quick upward thrusts. This action creates an artificial cough, pushing air up from the lungs and hopefully dislodging the blockage. Continue these thrusts until the object is forced out or the person can breathe or cough forcefully. Remember, it's crucial to act swiftly. Choking can lead to unconsciousness or even death if not addressed promptly. To conclude, choking aid can save a life within minutes. Burns, if not treated properly, can lead to severe skin damage. It's a startling fact, but an important one to remember. The first step in treating a burn is to cool it down. This can be done by running cool, not cold water over the area for about 10 to 15 minutes. Avoid using ice or icy water as it can lead to further damage. Next, the burn should be covered with a clean, non-stick bandage or cloth to protect the area from infection. Remember, it's crucial not to pop any blisters that may form, as this can also increase the risk of infection. If the burn is severe or covers a large area, or if it's on the face, hands, feet, or a major joint, seeking professional medical help is a must. Over-the-counter pain relievers can be used to manage pain, but never underestimate the importance of professional medical advice. Prompt and correct treatment of burns can prevent complications, so keep these steps in mind and stay safe. A fracture is a medical emergency that requires immediate attention. Now, fractures can be tricky, but don't worry, we're here to help you identify one. Firstly, look for signs like swelling, bruising, or deformity. The person may also be unable to move the affected area. Alright, now let's talk about how to handle a fracture. Your primary goal is to immobilize the injury, minimizing movement to prevent further damage. Start by placing a splint or a thick piece of cardboard on either side of the injured area. Then, using a bandage or cloth, bind the splint tightly but not so tight as to cut off circulation. Remember, this is a temporary measure until professional medical help arrives. If there's any chance of a head, neck, or back fracture, avoid moving the person at all. Instead, keep them as still as possible until help arrives. While professional medical help is necessary, these steps can provide temporary relief. Shock is a life-threatening condition that needs immediate treatment. Picture this. You're out on a hike and your buddy falls, injuring themselves. They're pale, sweating, and their pulse is racing. These are symptoms of shock, a critical state where the body isn't getting enough blood flow. So what do? First, call for help. Dial your local emergency number immediately. While you wait for help to arrive, it's crucial to keep your friend calm and reassure them that help is on the way. Next, get them lying down. If possible, raise their legs about a foot off the ground. This helps increase blood flow to the vital organs. You might also want to cover them with a blanket to keep them warm and prevent heat loss. Remember, your quick thinking can save a life. Shock can escalate rapidly, and every second counts. Quick action can prevent a shock from worsening. Heart attacks are fatal emergencies that require quick action. Recognizing the signs can be a lifesaver. Common symptoms include discomfort in the chest, shortness of breath, nausea, lightheadedness, or cold sweats. If these symptoms appear, don't hesitate. Dial your local emergency number immediately. Speed is of the essence, and professional medical help is crucial. While waiting for help, there are a few things you can do. If the person is conscious, have them sit down and rest to reduce strain on the heart. Encourage slow, deep breaths to help maintain oxygen levels. Aspirin can be a game changer. It helps prevent further blood clotting, which can worsen the heart attack. If the person isn't allergic, have them chew a standard dose aspirin tablet. Remember, it's not a cure but a temporary measure until medical help arrives. Every second counts during a heart attack. By acting quickly and calmly, you could save a life. Bleeding, if not controlled, can lead to a serious situation. It's a fact that an unexpected cut or injury can happen anytime, anywhere. And when it does, knowing how to manage bleeding is a skill that can make a significant difference. First and foremost, you want to apply pressure on the wound. You can use a clean cloth, bandage, or even your hand if nothing else is available. Press firmly and don't let up. This pressure helps to stop the blood flow and allows the body's natural clotting process to kick in. Next, you'll want to raise the injured area if possible. Elevating the wound above the heart level can help slow down the bleeding by reducing blood flow to the area. Remember, it's important to stay calm and reassure the person that help is on the way. Rapid and effective action can be crucial in these situations. Effective bleeding control can be a matter of life and death. So, arm yourself with this knowledge and be prepared to step in when needed. Allergic reactions can range from mild to life-threatening. It's a statement that might sound dramatic, but it's the truth. Allergies aren't just about sneezing in spring or getting itchy after eating shellfish. For some, an allergic reaction can escalate into anaphylaxis, a severe and potentially fatal condition. So, what are the signs of an allergic reaction? It could be as simple as a rash or hives, swelling, or difficulty breathing. If someone has ingested or come into contact with an allergen, their reaction might also include nausea or vomiting. Now, onto the lifesaver, the EpiPen. This is a pre-filled injection device containing epinephrine, which is used to treat severe allergic reactions. To use it, you remove the safety cap, press it against the person's thigh, and hold it there for about 10 seconds. Remember, time is of the essence when dealing with allergies. Prompt action can prevent a severe allergic reaction. Strokes are a major cause of serious disability. A stroke occurs when blood flow to an area of the brain is cut off, leading to the death of brain cells. Recognizing a stroke early can mean the difference between recovery and permanent damage. So how do you spot a stroke? Remember the acronym FAST. Face. Ask the person to smile. If one side of the face droops, it's a warning sign. Arms. Ask the person to raise both arms. If one arm drifts downward, be alert. Speech. Ask the person to repeat a simple sentence. If their speech is slurred or strange, it's time to act. Time. If you observe any of these signs, it's time to call emergency services immediately. Strokes are not something to be taken lightly. Even a few minutes can make a massive difference in the outcome. Early detection and treatment of stroke can reduce brain damage. So remember, act fast and save a life. First aid skills are invaluable in a crisis. We've journeyed through the essential techniques together, from mastering CPR and aiding someone who's choking, to treating burns and managing fractures. We've delved into the proper responses to shock, heart attacks, and severe bleeding, and heightened our awareness about allergic reactions and strokes. These skills are your toolkit in emergencies. Remember, the knowledge of first aid can make the difference between life and death. Stay prepared, stay safe.